like to say that the nurse is like the quarterback of the team.
team.
The quarterback doesn't work properly. We're all going to lose.
It's your body. You've been in this body way longer than this hospital visit. So if something just feels off, say something.
I was coming from work and the lady sitting next to me, I noticed that she was crying. And she was a nurse and she was listening to soft music and I was like, are you okay? And she just dropped even more. She was like, no, I had this case. This day was just devastating.
Welcome to Married to Nursing,
the podcast where we pull back the curtain on healthcare.
I am Armand.
And I'm Enna, a married nurse couple, and together with over a decade of experience.
We help patients and caregivers understand what is really happening behind the scenes,
so they can navigate healthcare with more confidence.
Are you ready?
Here we go.
There's a lot happening in healthcare that patients usually don't see it. So today we are taking you behind the scenes, pulling the curtains back. We are starting with something that we think every patient deserves to know. And that is what nurses see that patients usually do not see. So before we begin, just a quick note. This podcast is for informational and educational purposes only. The information that we share here, it's based on our overall or general experiences as nurses. There will be no identifying information of any patients or any person that we have taken care of in the past. So there's this big, should I say, complaint that most patients have that I've heard is that, oh, we don't get to see our nurses. Like my nurse just came in for the beginning of the shift and I barely saw her in the entire shift, or I didn't even see the doctor at all, and all of that. Like, what is happening when the nurses or the nurse is not there?
Oh, so when the nurse is not there, it doesn't mean that the nurse is still not taking care of you. The nurse is most likely going through your chart, getting orders, trying to put all the dots together on you in particular, like reviewing your labs. Maybe somebody already take your vital sign. They're trying to identify, to compare those vital signs to previous ones to see. Looking at labs, a lot of blood is drawn.
So basically, what you're saying is there's a lot going on behind the scenes.
A lot more going on behind the scenes that the patient don't see.
So it's not like the nurse is just abandoning the patient or sitting down somewhere just snacking on.
No, I like to use this kind of analogy. Like, let's say you are flying, you are traveling. When you sit in the cabin of the airplane, sometimes you sit there for half an hour, but it doesn't mean that the plane is not going to take off. You see, the pilots are in the cockpit checking all the systems, but they don't.
There's a long wait though sometimes. But
yeah.
I understand.
So it's the same thing. Basically, it's pretty much the same thing in healthcare also, that there's a lot of things that get checked before anything is done to the patient.
Okay, so let's talk about that. The invisible part of the care that the patients are not seeing, or the caregivers or family members are not seeing, but the nurse is doing outside the patient's room or in the nurse's station or whatever it is. So let's talk about that. So what is the nurse doing, without going into deep details? Like, what is the nurse doing before they even get into the patient's room?
Okay.
Let's pretend there's shift change. So we have a new nurse coming in or another nurse coming in. Like, what is that nurse doing before they even step foot into the patient's room?
All right. So
after shift change,
specifically at shift change, we review the patient's information, like vital signs. What has been the blood pressure, for example, or throughout the day? What are the orders that the doctor has given us? What medication the patient have taken? Has there been any type of reaction, any symptoms, any alleviation of the patient's concern? So you pass that along to the incoming shift or incoming nurse.
So shift report,
change,
like
shift
change.
report.
Okay.
Yes, exactly. And you also look at labs. We draw a lot of blood to do labs, to do lab tests. So you look at those results in comparison to how the previous result had been. Has there been any improvement in those labs? So you give those reports to the incoming person, and it takes time to do all that. So when you don't see us in the room, especially at shift change, that means we are basically passing the baton. So the person that is coming in knows how to take care of you.
Right.
You know.
And also, let's not forget, the nurse has multiple patients that
Oh,
they are taking
yeah.
care of as well. So that means they have to review all of this that you just mentioned, the labs, the reports, doctor's orders, and all of that for most of the time, depending on the unit, but let's say a basic medical unit, the nurse has up to 7 patients.
Yes.
So that means he or she is doing all of this for those 7 patients.
Yeah. We like to say that, you know, is one nurse, the nurse is taking care of you alone. But in reality, there is multiple patients on the floor.
It would be nice if it was just a one-on-one care.
One-on-one care, that would be lovely. It was lovely.
Yeah.
But in reality, that's the reality. We have, you know, depend on the unit, up to 7 patients to take care of. But ultimately, that particular patient is the point of focus.
Okay.
You know, so we have to be sure we don't mix information on different
That's
on different
important. You don't
patients.
want to
So
mix.
you don't want to give somebody, you don't want to treat somebody's information for another person's information.
Right. And another thing that the nurse is most likely doing too is triaging, like checking all his or her patients and seeing who is more acute or who requires immediate attention.
Exactly.
And you know, and it sucks. We have to be honest. It sucks for the person who's more healthy because then it feels like their care is delayed. But it is what it is.
It is a triage system because you're not gonna, if somebody is able to get up and go to the restroom by themselves, you're not gonna be in that room trying to help them go to the restroom. But if somebody is having a hard time breathing, you will spend more time because that person need more attention.
Right. That's a patient. Remember, we're talking about right after shift change. So that's a patient you want to see first because their level of acuity is higher.
So there is different things that come in to determine the level of acuity. So as doing report, you know, we think about all that.
Right.
Getting report, okay, what A, B, C, and D. Okay, I need to see this person first before I can see the person who can, you know, who has been able to feed them, you know, themselves all throughout the day. Versus the person who has had difficulty breathing. So you want to see that person first and make sure that
they're stable
enough while you go on and see other patients.
So basically, delay often means prioritization. It doesn't mean that you're being neglected or that their family member is being neglected, because that's often how it comes off. But that's not what it means. It's just the nurse is trying to prioritize care, and so that everyone will receive the best care from.
Prioritize and individualizing the care.
Ooh, I like that word, individualizing the care. Okay.
Individualizing the care to each and every patient.
All right. So now let's talk about those vital signs that you brought up earlier. What are nurses looking for in vital signs? So vital signs are blood pressure, heart rate, respiration, and usually it is the patient care assistant that comes in during the shift change to take the vital signs. So what does that show the nurse before they even begin their care of the patient? And the reason I want us to address this is because the patient care assistant, PCA, or the nursing assistant often takes vital signs on a normal floor, take vital signs probably like on a 12-hour shift, like four times during the shift. And I know a lot of patients complain about the frequency of vital signs. Like, why do you keep coming in here to take my vital signs? I'm alive, I'm okay. So that's why I want us to talk about what these vital signs are actually showing the nurse, or what it means, so that I think the next time a nursing assistant comes into your room, you understand what's going on.
The first thing I would say is any change in a condition will manifest itself in a change of vital signs. So vital signs like blood pressure, heart rate, respirations rate, those 3 things, and temperature, especially temperature. That's the whole, when we talk about sepsis. But those 4 different elements tells us when something is changing. You know, anything that deviates from those numbers tell us, okay, there is something going on.
Remember, even these PCAs, they have more patients than the nurses because they're checking multiple vital signs. So the blood sugar is supposed to be checked before the patient have their meal. And because the PCA is running behind with all the vital signs that he or she has to do, now the patient's food is right there, but the blood sugar hasn't been checked and the patient is angry. So I'm bringing that up just to inform or bring awareness to the fact that there's a lot going on. It requires patience. You know, they're not trying to punish. We're not trying to punish the patient,
of course,
or delay them having a meal or anything like that. But it's to make sure that you are getting the appropriate care and that the numbers are right and not, you know, affected because you took a bite of a cake or something.
And then one thing I can add to that is, you know, it can also be tied to prioritization, you know. So if we know that somebody's blood sugar fluctuates a lot,
Right.
we will tell the PCA, hey, go check this person's first, you know, so we can have a quick result before, you know, food comes in, and if any action needs to be taken, will be taken in due time.
Right.
Yeah.
So all this, basically to sum it up, all these vital signs check, the questions that the nurses are asking, because sometimes we do have to ask multiple questions, and sometimes we're repeating the same questions because we're trying to establish baseline and make sure that things are not deviating from your norm. So it can be caught
on time.
So these are what nurses do that patients don't see. They pay attention to the early warning signs, so you know things don't go south.
Exactly. We don't want anything to go very quickly.
Okay.
Very quickly. So, yeah, there is a joke among us. It's like, you know, when you come into a hospital, don't lie because we'll find out. The truth is gonna be in the blood, you know. So just tell us, you know, what we just give us the truthful answer. Because not telling us the right answer right then and there is only going to delay your care.
Right.
Because you know, it's going to take time to find out what the blood is revealing, and it's going to delay any type of intervention that we need to do.
I think there's also a saying that says the three people that you don't like to is your lawyer, your doctor, and your pastor.
Yeah, exactly.
Nurses and doctor, your healthcare professionals, you know, together. Okay, so now let's move on and kind of discuss the system gaps that nurses see as well, talking about nursing shortage, because that also affects the care or delays care. I don't like to use the word delay care because it's not being delayed, but it's being prioritized. But this system gaps, this shortages, this which leads to medication errors and, you know, things like that.
As far as I can remember, we always talk about nursing shortage. Even when I was in school, I don't want to tell how long ago, but talking about nursing shortage.
Right.
Yeah, and those shortage, you know, create gap in the system.
Yeah.
You know, results coming in creates gap. Information, communication, lack of communication creates gap. So to bridge those gap is very important, because any missing information can create, you know, a cascade of event that we don't want to see.
Right.
So
as you're talking, I just remember another gap. The nurse is basically the one filling the gap between other healthcare, the ancillary staff, like the OT, physical therapy, occupational therapy, the doctors. The nurse is also getting information from multiple departments, and it's just that one nurse. And the pharmacy.
I like to say that the nurse is like the quarterback of the team,
right?
Because as a quarterback, for those who like football, you get the ball and you have to scan the whole field to see who is you throw the ball to. So the nurse is the quarterback. If the quarterback doesn't work properly, we're all going to lose.
Be nice to the nurse.
Be nice to the nurse, you know. So, and the more information the nurse gets, the more the nurse is able to do his or her work.
Right.
The better it is for everybody. So, healthcare institutions are always and constantly working to fill those gaps. That's why we do, like, you know, root cause root cause analysis. I don't want to go into those things, but always looking for where we can fill the
Bridge the
gap.
gap.
Yeah, bridge
Because
the gap.
one of the things that patients don't often see is the medication error that the nurse caught before it even got to the patient or before it got to their loved one. You don't see that before the nurse even comes in. He or she is checking the medications, checking the orders, making sure it's the right medicine and all of that before they
Yeah.
even get in, because a lot of nurses have caught a lot of medication errors before it even happened.
Exactly.
And that is something that patients don't often think about. They, especially when it comes to pain medicine, for example, they often feel as if the nurse does not want to give you the pain medicine. But no, the nurse is trying to make sure that it's the right patient, right time, right dose, before they even give it to you. All right. And another thing that patients don't see is the nurse spending a lot of time clarifying or double checking the orders, because sometimes there are conflicting orders. There's miscommunication. The doctor may be saying one thing and this other doctor is saying something else. So the nurse is trying to bridge that gap behind the scenes, checking, making sure that everything is right.
Especially when a patient is seeing multiple specialists.
Right.
Somebody in a hospital can see a cardiologist, a kidney doctor, a heart doctor, a kidney doctor, a brain doctor, and all those people can write different medication.
Right.
So we want to make sure that none of those medication is interesting. That's why pharmacy comes into play. Pharmacists will review all those things, and we get a call from pharmacy, hey, there's a double order on this drug, or this drug has been ordered is two different doses. So which one do we go by? So the nurse has to call
the
doctor
to clarify.
Hey, to clarify this medication has been ordered, etc., etc. So background words, communication between team members is interdisciplinary teamwork.
Yeah, the one that I've seen a lot is sometimes too the doctors will order something for a patient and the nurse catches it and say, no, my patient is, let's say, taking blood thinners and you ordered XYZ and this patient is not supposed to be taking or eating this kind, or the patient is going for surgery in the morning. You need to put the order to be NPO, which is nothing by mouth. So the nurse is catching all of that behind the scenes. So that's something that the patients are not seeing. Also, discharge planning, like the challenges with discharge planning. And the reason I wanted us to talk about this is because sometimes once the doctor comes in, let's say in the morning, making their rounds at 6 a.m. and they put in a discharge order or tells the patient that you're getting discharged, I've put in the orders, then the patient thinks, okay, my doctor has discharged me. I'm going to be out of, I need to be out of here now. But in reality, there's a lot that the nurse has to make sure is in place before you even get the discharge paper. So yes, the order was probably put in at 6. That's one. The order was probably put in at 6, but you don't end up leaving the hospital till 6 p.m. Or 2, the doctor told you that he is putting the order or that you're getting discharged. But in reality, that order was not put in. So now the nurse is having to hunt down the doctor, call the doctor, and all of that to say, I need the order for discharge. And then the patient is thinking it's just the nurse.
Yeah. So true. Those things happen all the time. Yeah. Like you say, the doctor will come in the room 6 a.m. because that's most of the time, that's what time they do their round. Like, are you going home today?
All right.
Okay. But we have to give it to the doctor. That doctor may have up to 25 patients.
True.
That they have to round on that morning.
Yeah.
So they come to you and say, you're going home today. Go to the next room, you're going home today. After he say you're going home today, to everybody that has to go home, that's why he's gonna go sit down in front of a computer and put those orders in.
Yeah.
So by the time he sits down and put those orders in, it's probably 2 to 3 hours later. The day's still going. Care still has to continue. We still have to continue giving care. And patient will be like, oh, well, why am I not leaving?
All right.
There is that gap that needs to be filled.
That the nurses feel.
Before you can go home. And besides doctor putting in orders, once the order gets in, we have to reconcile it, basically
Right.
make sure that everything is on point.
Mhm.
So if we see any type of discrepancies, we have to correct that
Correct it
discrepancies
before.
we can say, oh, okay, go home.
Yeah.
Right.
I want us to talk about what nurses notice about patients. For example, emotional changes or mood changes, this things that nurses are paying attention to, but the patient has no idea that the nurse is actually monitoring. Maybe you had a patient at the beginning of the shift was happy, talkative, being interactive with you, and then some people came to visit,
Oh,
and all of a sudden the people leave, and you go back in to check on the patient, and now their mood has changed. They're not as talkative or interactive with you. What does that say anything to the nurse? Does that ring a
no,
bell?
definitely.
Is that a concern?
It's a concern. It's because the goal is to get the patient better. So
Right.
if somebody is coming in there and not helping them get better, you need to speak up and say, hey, and the nurse also needs to pick it up like, okay, this what happened up until this visit, the person was fine. So what happened afterward?
Yeah.
So if we don't need the person to come back, you let us know.
Right.
We'll make sure the person doesn't
So
come back.
that's something that I really want to stress on, because it's their care. As a patient, you have every right to speak up for yourself.
Exactly.
You can decide, I don't want this family member to come in. Just let the nurse know, and they'll put that, or they will let the front desk know or anything. But yes, the nurses, that's something that nurses are doing, paying attention to these cues, decreasing appetite, because that could signal something going wrong with your care or your health. Emotional changes, withdrawal, fatigue, family dynamics, caregiver stress, all these are things that the nurse is paying attention to, that the patient has no idea that is even happening.
I would like to add that, one thing we often also say is your body.
Right.
You've been driving that body longer than that visit.
Right.
That admission. So listen to your body, and whatever sentiment you are having, express it.
Even if it's just I don't know, something feels off. Say that to the nurse, because they take that seriously. Like you're saying, it's your body. You've been in this body way longer than this hospital visit. So if something just feels off, say something. The nurse will take that seriously. But now let's kind of shine the light on the nurse as well, to give the nurse grace, because there is an emotional side of nursing that patients don't see. Again, nurses take care of a lot of patients, and some of these patients are going through so much that it's almost as if the nurse becomes therapy for them. Or even you've had times when you come back and you tell me, oh, I took care of this patient today and it was so devastating, or it made me so feel this way or that way. So what patients don't see is the emotional baggage that the nurse is leaving the hospital with, because of the care or the patients that he or she has taken care of.
Yeah, that is a big one. But just as a joke, is how nurses say, "Oh, I can hear the beeping of the machines."
Right.
That's one thing that we carry home too.
Right. At night, you're hearing
you hear
the machine
all the
beeping.
machines beeping left and right. But yeah, emotionally, especially when you have difficult cases, you carry that with you. You absorb everything.
Right.
People say, yeah, you over time you learn to drop it at
the door, the hospital door,
at the
before you
hospital
get home.
door.
Yeah.
But
it takes time
to
get there.
and some you can't drop.
You can't, right.
I have a plethora of patients in my head that I've taken care of, that I still see their faces. I still think about them.
Yeah, you remember conversation
about them.
Yeah.
Just recently, I was coming from work, and one place I work at, we have to take a shuttle, and the lady sitting next to me, I noticed that she was crying, and she was a nurse. So usually we just stay quiet, and she was crying, and she was listening to soft music, and I was like, "Are you okay?" And she, her tear just dropped even more. She was like, "No, I had this case today. It was just devastating." And that is what, and we all have family. I mean,
Right.
most of us
The
are
nurse is
family.
human. We're human. We're not robots.
Exactly. You have
So
to
we
go home and
they
take
have
care of
their
your
own issues
family.
too. Yeah.
Exactly. And we have instances, you see things, you think about your own kid,
Yeah.
or you think about your own loved ones,
Parents or loved
oh
one.
my
Yes.
goodness, and it's very, it's very emotional
Right.
tasking.
It
So
is.
you have to know. I think for the nurses, you need to know about that and know when to like let it go or talk about it so you
Right.
can relieve yourself from that burden.
Yeah. But one thing I want us to really drive, or that I want it to be a takeaway, is that the nurse is human. He or she is not a robot. They have feelings. They have things they're going through. And I think, let me not say I think, I believe that healthcare would be better if both sides, so the
Yes.
healthcare provider and the patient, both have mutual respect and understanding and give grace to the healthcare provider that's taking care of you.
True. You hear stories that had happened to me. I'm sure it had happened to you. Patients saying things, that are not very nice.
Right.
And both way too. Nursing saying things to
Things to the
patients that are
patients,
not.
right.
But I guess we have to remember that we are here for each other.
Each other, yes.
It's about the human connection. So if we can think that way, I think it will make things a little better for both parties.
Right. All right. So let's just summarize it all. The key takeaways for everyone to leave here today. Questions improve care.
Yeah.
So make sure
answer the questions.
Yes.
Just be truthful right away, so we don't delay care.
And even the family members that are in the room. Yes, maybe it's. I know that sometimes the nurses may seem irritable or irritated, but ask. You are your best advocate. Ask the questions and answer honestly.
I think one thing I would like to add is, if there is a family member in the room that you don't want them to know an answer to a certain question, you don't have to say. You can just let us know once the family member leaves.
Yes.
Or you can ask the family member to leave the room.
Well, you don't want to do that, because then that's gonna. Maybe
Whichever.
the nurse can do that if the nurse picks up on that cue.
Yes.
Can you please step aside and talk to the patient? Remember that your voice matters as the patient. Your voice matters, and transparency builds safety. So be honest, be vocal about your care. Be your first advocate. The nurse also advocates for you, but be your first advocate. And yeah.
Everything that we do is for the benefit of the patient. So when we come into a room multiple times, is to gather enough information to better take care of you.
Right.
We are not trying to irritate you. Little subtle cues that we picked up help us better care for you.
Yes.
And at the end, know that it's a game that is played between two people. So I'm saying a game, but that's the best way I can say it. So the better we take care of you is also the better you can take care of us, if I can say it that way. Right.
Yes.
So we are human. So let's do the human connection thing.
Right. So that's why we are here, to kind of bridge the gap and to help you understand what nurses are seeing behind the scenes that you as a patient or as a caregiver or family member don't get to see. So we're here to provide information and help you be more confident, so you can better advocate for yourself or your loved one that may be in the hospital. So today, we hope that you did gain some value from this episode and you learned a thing or two. And if that's the case, please subscribe to this channel and this YouTube channel, and like the video as well, and share it with someone. If you're listening on Apple Podcasts or Spotify, please leave us a review and share the episode with someone as well that you know is going to benefit, or this episode is going to be a value to. So we hope that we have been able to pull back the curtains a little bit, but this is just the beginning. There's more that we're going to discuss and shine light on, just to make sure that you're better informed and better empowered to take or to advocate for your healthcare.
And if you have any question or any subject that you would like us to talk about, just let us know and we will dive into it.
Yes. So next episode, we're going to be talking about the most dangerous time in healthcare, discharge time. All right. All right. So we'll see you next time on the next episode. Anything else?
No, that's it.
That's it. All right. Take care, everyone.
Take care.
Bye.
Bye.